Welcome to Best Practices for Dementia-Friendly Hospitals. In this video, you will learn strategies for creating a safe and inclusive hospital environment for persons living with dementia and their caregivers. This video aims to help build a more dementia-capable North Carolina. So, what is a dementia-friendly hospital, and why is it important? Meet Joyce and Martha. Both are 82 years old, living with dementia, and both recently experienced a hospital stay due to an infection. Joyce went to the emergency room after a wound on her leg became infected. She was administered a cognitive screening test after exhibiting signs of confusion in the emergency room. Her score indicated a likelihood of dementia, and her daughter later confirmed a dementia diagnosis. A patient companion volunteer provided Joyce with water, dimmed the room's lights, and found a warm blanket for Joyce. Joyce was able to rest while she waited to be seen. Martha also went to the emergency room with an infected wound. She sat unattended in the triage bay for 3 hours while she waited to be seen. Martha found it challenging to communicate her needs to the triage nurse. By the time her son arrived, Martha had become more confused and agitated. After an hour, Joyce was admitted and taken to a private room. When she arrived at her room, she noticed a large yellow sunflower above her bed. This made Joyce feel happy. A small purple magnet was placed on Joyce's door to discreetly notify all hospital staff that Joyce is a person living with dementia. Joyce had regular check-ins from her companion volunteer, who provided her with a sensory fidget sleeve. The sleeve, which was knitted and decorated with beads, buttons, zippers, and colorful sequins, provided a stimulating activity for Joyce's restless hands and distracted her from removing her IV. Joyce's daughter could stay with her after visiting hours and even overnight, and the night nurse left the lights off when conducting vital checks. Joyce was discharged home after 3 nights. After spending a night in the emergency room, Martha was finally admitted to the hospital and placed in a shared room with another patient. The constant foot traffic contributed to Martha's additional confusion and agitation. Martha attempted to leave her bed on several occasions and refused to eat the meals that were provided. Martha remained in the hospital for 4 nights, was discharged home, and returned to the emergency room 2 days later after a recurrence of symptoms. What are some of the differences you noticed between Joyce and Martha's experiences? It seems clear that Joyce's experience was much more positive, from the ways the staff interacted with her and her daughter to the hospital environment. That's because the hospital she attended has adopted dementia-friendly protocol and is a dementia-friendly hospital. In contrast, Martha had trouble communicating with the staff. Her son was not included in her care, and the hospital environment contributed to her further confusion and disorientation. Despite both being hospitalized for similar issues, Joyce's experience resulted in a better patient outcome with a shorter stay, discharge home, and no readmission. Martha's stay was longer, yet she returned to the hospital within just a few days. There are many advantages to a dementia-friendly hospital environment. Here are a few. Patient care is enhanced. There is a concerted effort to reduce patient anxiety and agitation. Improved communication is emphasized. Safety is considered thoughtfully. Caregivers are supported. The entire hospital community is engaged. Employees receive training on dementia and how to interact with people living with dementia and their caregivers. These inclusive and supportive efforts contribute to better results for all. Typically, older adults living with dementia are hospitalized 3 times more often, have longer hospital stays, and have more emergency room visits when compared to older adults without dementia. Nearly 12% of all adults over 65 in North Carolina are living with dementia. These rates are projected to grow over the coming years. It is critical that hospitals begin to implement dementia-friendly practices to meet this growing need and improve patient and caregiver outcomes. The two most important principles of dementia-friendly hospitals are to include and involve people living with dementia in the effort, and to establish and maintain a team that works collaboratively to create change. The hospital can be a confusing and frightening place for people living with dementia. Here are some reasons why. Unfamiliar environment, complex layouts, sensory overload, communication barriers, change in routine, lack of personal belongings, isolation, medication side effects, sleep disturbances, rapid changes in care staff. Dementia-friendly practices create an inclusive and supportive environment. They also enhance understanding and awareness about dementia within the hospital community. Clear and simple communication promotes interactions that are respectful and engaging, reducing social isolation for those with dementia. Adapting physical spaces within the hospital ensures accessibility for all. Dementia-friendly practices also make sure that care is focused on each person's needs, fostering a sense of dignity and respect. Overall, these practices empower the hospital community to embrace and support individuals with dementia, contributing to a more compassionate and inclusive organization and society. North Carolina is committed to becoming a dementia-capable state. Through its strategic plan for addressing Alzheimer's disease and related dementias, North Carolina is encouraging communities to take steps toward this vision. Let's look at some of the ways hospitals can do that. To begin, there is a set of minimum standards as a starting point for a hospital or community to establish a dementia-friendly initiative. Look at how a hospital in Wayne County has introduced a pilot program focused on becoming dementia-friendly.
It'll make you worry, won't it?
Caring for patients is Kim Guillemet's job at UNC Wayne Healthcare in Goldsboro.
I reckon the cousins.
She says one of the most important lessons she learned in nursing school was to make sure the patient is alert and oriented.
It's important that they know what's going on. It's important that they know where they are so that they can interact as part of the process.
But a new initiative designed to make hospitals more dementia-friendly goes against that training.
Well, we really didn't have a true approach in the past. You know, we took care of patients. If they seemed confused, we tried to determine how safe they were, but we really didn't have the knowledge and the education of how to approach them.
Are you going to help me out?
UNC Wayne Healthcare is one of several hospitals in North Carolina participating in the Dementia-Friendly Hospital Initiative.
Because working with dementia is very difficult.
It's a UNC pilot program that trains healthcare workers how to approach a patient with dementia, and more importantly, to meet patients where they're at through role-playing exercises. Anyone who comes into contact with a patient, from housekeeping to security, receives this training.
Now I might approach someone who thinks we're at their house, and I might say, well, you have a beautiful home. It's just important to be agreeable and okay and accept them wherever they are.
For every 1,000 people in North Carolina with dementia, there are an estimated 1,600 emergency room visits. Experts say patients with dementia are admitted more often and end up in the hospital longer.
It's costly for the patient family, for the healthcare system, and for the patient themselves.
The hospital also installed purple lights to signify a patient with dementia. And the hospital created these dementia busy boxes to help preoccupy patients as they receive care. The Dementia-Friendly Hospital Initiative requires extra time in an already stretched hospital system. But the healthcare workers at UNC Wayne Healthcare say it's been worth it.
but we look at the reward. We look at the reward of having people stay less in the hospital, less complication, less cost, and less life lost. So that's our reward of taking time and having enough staff to do this job.
You're doing real good.
A new way of nursing that is paying off with the growing number of patients being treated with dementia.
What do you think?
Dementia-friendly hospitals emphasize 4 overarching themes: interacting with people with dementia, ensuring continuity of care, providing person-centered care, and adaptation of the physical environment. Let's look at each of these more closely. Whether a patient has dementia or you suspect they may, here are some communication strategies that will aid your interactions. Make sure to introduce yourself before every interaction. Speak slowly and maintain good eye contact. Allow the person time to respond. Do not interrupt or finish their sentences. Engage the individual one-to-one in a quiet space without distractions. Ask yes or no questions. Use positive communication like, "Would you walk with me?" or "Could you help me?" Keep directions simple, one instruction at a time. Be patient, encouraging, and supportive. Continuity of care reduces care fragmentation. This aids in improving patient outcomes. There are many steps your hospital could take to achieve continuity of care. Here are some examples. Keep patients' staffing consistent. Conduct hourly safety and comfort checks. Use a color-coded system to identify patients with dementia. This might be a purple sticker or magnet on the door. Provide dementia education and training for all staff and volunteers. This should especially include any staff member who may interact with a patient or their family. Obtain baseline behavior information from the patient's family and caregivers. Create a plan to recognize, assess, and intervene if a patient becomes agitated. Encourage questions, especially regarding discharge. Ensure post-discharge care is coordinated and communicated to caregivers and providers. Person-centered care promotes independence and supports a patient's emotional and social well-being. Discuss patient preferences and potential triggers with the family. Develop flexible and easily adaptable care plans for patients. Allow patients to have familiar items and provide favorite snacks. Use the patient's preferred name and pronouns in communication. Solicit feedback from families, asking how assistance can be improved. Maintain flexible visiting hours and provide quiet resting areas for caregivers. Provide music, pet, and aromatherapy services. Train volunteers to provide companionship to patients. For individuals living with dementia, the physical space can play a key role in helping them stay safe, feel comfortable, and maintain independence. At your hospital, you might establish a dedicated unit for dementia patients. Provide private rooms whenever possible. Set up a common dining room for ambulatory patients. Minimize noise in and around patient rooms. Arrange rooms for safety, preventing falls and wandering. Use recognizable visual symbols to label key items, for example, bed, toilet. Designate a respite area close to the nurse's station for families. Incorporate soothing colors and artwork in the environment. So, how can you help ensure that these principles become fully realized throughout your hospital? Let's walk through some specific steps you can take. First, engage your hospital's leadership and community to introduce dementia-friendly principles and raise awareness about the initiative. This phase will be critical in the future implementation of dementia-friendly principles. Once you have leadership on board, you can form your action team. Your action team should include people living with dementia, caregivers, and hospital staff. It may also include individuals from the local community, such as first responders and adult services workers. When implementing their dementia-friendly initiative, UNC's hospital system found it helpful to include a champion from each unit on their action team. This individual, often in a clinical role, would act as a liaison for the unit and the action team. The next step is to educate and train all hospital staff on dementia-friendly principles. Many hospitals tailor trainings for clinical and non-clinical staff. For dementia-friendly principles to be effective, all hospital staff members should receive training, even if they do not provide direct patient care. For example, housekeeping and dining services staff. Ensuring education for all enhances the hospital experience, particularly for those with dementia. Some hospitals make care cards available for each unit, which highlights key principles and strategies to use when caring for people with dementia. A third step is to engage volunteers from the broader community. Many dementia-friendly hospitals utilize volunteers to provide companionship to patients. They help to ensure the patient is comfortable and engaged. The Outer Banks Hospital, for example, developed a volunteer companion program as part of their initiative. They suggest, start with a small group of volunteers. Ensure volunteers receive comprehensive education. Provide volunteers with clear and transparent guidelines. Support your volunteers. It is important that volunteers, staff, and caregivers are all aware of the volunteer's role and the ways they can provide support. Finally, it is critical to partner with patients and their caregivers. When beginning your initiative, speak with people who are living with dementia and their caregivers. Ask how the hospital could best support them and meet their needs. In doing this, you are already engaging in dementia-friendly practice. Caregivers will be critical to patient outcomes. Ensuring that they are supported is key to a successful initiative. Remember to identify ways to measure outcomes to ensure your initiative is meeting the hospital's goals. By implementing a dementia-friendly hospital design, you are not only supporting persons living with dementia, but also their caregivers, visitors, and staff in their caring role. Finally, you may wish to join the North Carolina Network of Dementia-Friendly Communities and Hospitals. The network is an initiative of Dementia Capable North Carolina and holds a quarterly virtual meeting, which you are welcome to attend. To learn more, visit www.ncdhhs.gov/DementiaCapableNC. This video was created by CARES at the UNC School of Social Work for the North Carolina Department of Health and Human Services, Division of Aging.